So, but I thought I'd just start by just explaining briefly what Docobo, our remote monitoring platform, is when we talk about remote patient monitoring. This is where you've got a range of what we call patient interaction options. These are either tablets or devices or web access for people in their own homes or in care homes to be able to use to collect data. And the data is things like obviously vital signs, blood oxygen, blood pressure, those things. But more importantly, things around symptoms. How breathless is someone feeling? How poorly are they? How swollen their ankles? Symptomatic information that's collected on a day-by-day basis or as and when basis from individuals. And basically it's either the patient themselves taking the data or their carer inputting the data for them. And there's a range of ways to meet different people's technical and cognitive abilities to put data in. But that data is all collected, it's transferred securely, it's encrypted, clinical databases that sit within the NHS intranet. And then from there, clinicians can log in, and there's all different range of clinicians use our system. They can log in to Docobo directly and view the patients, manage the alerts, send messages to the patients, read messages that come back. From there, they can also initiate a video conference call out. So the system allows fully customized questions. You can also do surveys, so PROMs and PREMs, and you can set alert settings for any of the data we collect. You can set the system to generate an alert or notification to the clinical teams here. Because of that, pretty much any condition is monitored, and we go from long-term conditions, we go care homes, we have even monitoring people on a cardiac surgery waiting list. Quick overview, what is it generally aimed at, remote monitoring? Well, it fits in a lot of places. Primary care, obviously long-term conditions is the main area it sits in with that, but also sitting in things like mental health, medication, psychotic drugs, things like that. Acute managed patients, kind of name of the flavour of the month at the moment is virtual wards, but there's a whole area where it can be used within hospitals for different specialities. The world's your oyster, if you like. It's just a matter of thinking up what type of information do you want to collect from patients.